Welcome to Wally's Nursing Videos, your trusted source for nursing education and professional development. In this extensive video, we embark on a journey to delve deeply into the world of neurological diseases, providing a comprehensive understanding of 7 major conditions: Parkinson's disease, seizures, Alzheimer's disease, amyotrophic lateral sclerosis, ALS, multiple sclerosis, MS, Guillain-Barré syndrome, GBS, and myasthenia gravis. We will leave no stone unturned as we explore each disease, covering their overviews, clinical manifestations, diagnostic methods, treatment options, and crucial nursing considerations that are indispensable for nurses. Neurological assessment. Our journey begins by underlining the foundational importance of neurological assessment in nursing. Effective neurological assessments are the bedrock of patient care, enabling nurses to detect subtle changes in a patient's neurological status, which is vital for timely interventions. By accurately assessing neurological function, nurses play a critical role in patient outcomes. Parkinson's disease. Moving to our first destination, Parkinson's disease. This chronic and progressive neurological condition has a wide array of clinical manifestations, from the hallmark resting tremors to bradykinesia, slowness of movement, rigidity, and postural instability. Diagnosing Parkinson's often relies on clinical evaluation, and its management includes a range of treatment options such as medications, deep brain stimulation, and physical therapy. In the world of nursing, careful medication administration, fall prevention strategies, and the promotion of patient independence are essential considerations when caring for Parkinson's patients. Seizures. Our next stop is seizures, which are characterized by sudden and uncontrolled electrical disturbances in the brain. Clinical manifestations during seizures vary, including tonic-clonic movements, changes in consciousness, and sometimes, in the case of absent seizures, brief lapses in awareness. Diagnosis usually involves a comprehensive medical history, electroencephalogram, EEG, and neuroimaging. The treatment approaches encompass anti-epileptic medications, lifestyle adjustments, and occasionally, surgical interventions like vagus nerve stimulation or resective surgery. Nursing considerations are of paramount importance, particularly during and after a seizure. This involves adhering to seizure safety protocols, precise medication administration, and providing emotional support to patients and their families who may be understandably distressed by the unpredictable nature of seizures. Alzheimer's disease. Our journey now takes us to Alzheimer's disease, a degenerative brain disorder with clinical manifestations that often begin with subtle memory problems and gradually progress to more profound cognitive and behavioral changes. Accurate diagnosis may involve neuropsychological testing and neuroimaging. Though there is no cure for Alzheimer's, cholinesterase inhibitors can help manage some of its symptoms. Nursing considerations in Alzheimer's care revolve around effective communication, particularly as the disease progresses, as well as managing behavioral challenges and ensuring the safety of patients who may be at risk of wandering or other potentially dangerous behaviors. Amyotrophic lateral sclerosis, ALS. Next on our journey is amyotrophic lateral sclerosis, ALS, a devastating neurodegenerative condition characterized by progressive muscle weakness and atrophy. The clinical manifestations of ALS often begin with weakness in a single limb and spread to other body parts, eventually leading to respiratory difficulties. Diagnosis may involve electromyography, EMG, and nerve conduction studies. While there is no cure for ALS, some medications can slow the progression of the disease. Nursing considerations for ALS care are multifaceted, with a strong focus on respiratory support, as many patients with ALS eventually require assistance with breathing. Additionally, addressing the emotional needs of ALS patients and their families is a crucial aspect of care, as living with ALS can be emotionally and psychologically challenging. Multiple sclerosis, MS. Our journey now takes us to the complex world of multiple sclerosis, MS, an autoimmune disease that affects the central nervous system. The clinical manifestations of MS are diverse, with symptoms varying widely between individuals. Common symptoms include muscle weakness, sensory disturbances, and problems with coordination. Diagnosis often involves a combination of medical history, neurological exams, MRI scans, and lumbar punctures. While there is no cure for MS, disease-modifying therapies can help manage the condition and reduce the frequency and severity of relapses. Nursing considerations are extensive, with strategies for managing the debilitating fatigue often associated with MS, promoting mobility and independence, and providing emotional support to patients who may experience anxiety, depression, and cognitive changes as part of their MS journey. Guillain-Barré syndrome, GBS. Our next destination is Guillain-Barré syndrome, GBS, a rapidly progressive autoimmune disorder that affects the peripheral nervous system. The clinical manifestations of GBS often begin with weakness and tingling in the legs and can progress to total paralysis, affecting the respiratory system. Diagnosis of GBS involves clinical evaluation, nerve conduction studies, and lumbar punctures to assess cerebrospinal fluid. Treatment options include intravenous immunoglobulins, IVIG, and plasmapheresis. Nursing considerations in GBS care are critical, focusing on monitoring respiratory status, as many patients require mechanical ventilation, promoting mobility to prevent complications like pressure ulcers, and providing emotional support as the sudden onset and severity of GBS can be emotionally distressing for patients and their families. Myasthenia gravis. Our final destination is myasthenia gravis, MG, an autoimmune neuromuscular disorder characterized by muscle weakness and fatigue. Clinical manifestations of MG often include ptosis, drooping eyelids, diplopia, double vision, and difficulties in swallowing and speaking. Diagnosis may involve blood tests to detect specific antibodies, neuroimaging, and electromyography. Treatment options for MG include anticholinesterase drugs, immunosuppressive therapy, and thymectomy. Nursing considerations are integral to the care of MG patients, with a strong focus on medication management to ensure patients receive their medication at the correct times and in the appropriate doses. Respiratory support may be needed in MG exacerbations, and addressing the emotional needs of patients is crucial, as MG can be physically and emotionally taxing. In conclusion, our goal is to equip you, as nursing professionals, with a profound understanding of neurological diseases. We hope this video serves as a comprehensive resource to expand your knowledge and enhance your patient care skills. Thank you for joining us today on Wally's Nursing Videos. If you found this video informative and helpful, please like, subscribe, and share it with your fellow nurses. Your support enables us to continue creating educational content. Stay tuned for more in-depth videos, and remember, your dedication and care make a significant difference in the lives of those in need.